A simple cut, a shocking child, a burn from hot steam. In just seconds, a normal day can become an emergency. But here is the truth. Most Kenyan homes aren't ready. And the price of being unprepared is a life. Welcome to Wellness Health Services Health Talks. I'm Dr. Joshua Nderitu, a family physician. I have interest in public health and cancer prevention and treatment. In this video, I'll show you 5 of the most important first aid essentials every Kenyan home must have, and why one of them could mean the difference between life and death. So stay with me to the end so that you get 90% of what most of the households forget. So let's dive in. 1. In your first aid kit, you need to have an antiseptic and clean cotton wool or gauze. The antiseptic could be spirit, could be alcohol, or anything to clean, so that you remember that infections from small cuts or scrapes are still a major cause of illness, and this is so especially in children. So if you have these antiseptics, then they will help you to clean up and avoid germs from whatever emergency that you have. So have some antiseptic like spirit or Dettol or Saplon, or even a saline solution on hand. And this is not just for kids. It can be save a diabetic wound from turning into amputations. So do not ignore this. Have them in your first aid kit and always have them ready at hand. And if you have them, always remember to check the expiry date so that if they get to expire, then you can always replace. The second thing that you need to have in your first aid kit is sterile bandages and plasters. Remember that after cleaning a wound, covering it properly prevents infection and reduces bleeding and speeds up healing. Actually, most of the wounds, especially the ones that you are bleeding, by covering them, and you cover them properly and with the pressure, you reduce the bleeding, and this could be only what that wound needs, and you are able to stop the bleeding, and then you can be able to save a life. So you never know when an accident can happen. It could be a motorcycle accident, it could be kitchen cuts, it could be school injuries. Bandages are always necessary. And even those who have motorcycles, or they are even in our cars, we need to have these first aid kits, and not only have them for the police, but have them properly equipped. One of the things that you really need in that first aid kit is a sterile bandage. So make sure that it is available. So let's look at another requirement for your first aid: a burn cream or an aloe vera gel. So in Kenya, hot water burns are almost like a common occurrence. You have charcoal jikos, you have cooking oils which can spill on you, and these are common causes of burns, and this is very common in children. It's not unusual that a toddler is walking in the house, he just grabs a cup with hot tea, and all of a sudden an emergency has come. What do you do with this child who is scalded? You may need to clean the burn with cold water, and learn it over time to cool the tissues. Do not use ice, just cold water. Learn the water over 5 minutes over the area that the hot liquid has poured on, and then you can apply a burn cream, and they are all available. So aloe vera, the burn ointment, sulfadiazine, what we call dermazine, is highly available, and you can buy it over the counter. So never apply things like toothpaste, never apply things like oil on burns. These can worsen the burn, and do not clean the burn with milk or ice. Just run cold water over the burn, and this will help you to cool the skin. Do not include things like toothpaste or raw eggs. Just cool running water plus the burn cream will be what your child or the victim needs. Then pain relievers and fever reducers. As you know that accident and injuries are accompanied with pain, and fever and pain can come suddenly. Do you know what to do? It could be malaria, it could be teething problems, it could be infections. And remember that fever in children can come with convulsions. Convulsions are those jerky movements that kids have. They can lower their head, they can lower their legs, and they can turn their eyes, the rolling of the eyes. This could be a sign that the child is having convulsions. Are you ready to take care of this child? Do you have something to relieve the fever so that you avoid this? Of course, in children, even before you go for the pain relievers, undress the child, expose the child. You can do what we call tepid sponging. It's just taking some warm water and trying to sponge the child so that you cool the temperature, and expose the child so that you lower the temperature. And then, of course, after that, you can give him paracetamol or brufen, and have some dosage charts to help you remember the appropriate dose for age and weight. So avoid aspirin in children under 12 years. It can cause an inflammatory reaction that we call Leigh syndrome. But paracetamol, brufen, all these are good painkillers that can help you in times of an emergency. Then having gloves plus the CPR barrier mask. I know the CPR barrier mask is highly discouraged these days because of cross infections, but it is important that you know that it is there. But having gloves, if you get someone who's not breathing and his heart is not beating, you can just do the heart massages, and this will help them to revive back. So in emergencies, gloves will protect you and your patients from getting infections, and the CPR mask can help you to safely give the life-giving breath. If you are not able to do that, you can just compress the chest and try to make the person restart breathing again. This is important even if you don't have any training and you are willing to act and ask for help. Even with the simplest tools, you could save a life and give a person a chance to see another day. So take up the challenge. So it is also important that you know that you have some emergency numbers that you can call to when you do not know what to do, and when you have found an emergency. So do not be in the blackout. At least have some emergency numbers that you can call. And then also it is important that you have a flashlight so that it can help you be able to see through. So have them printed and posted somewhere where they can be seen, so that when there is an emergency, everybody knows where to call and where help can come from. So emergency, don't wait for us to be ready, but just with a few items, you can be able to help a life and save a life. So protect your family and bring peace in moments of panic. Please remember to subscribe to the Overall Health YouTube channel, and remember to share this with someone who does not have a first aid kit, so that this will be a wake-up call for them. We meet in the next video. Thank you for watching.